Oh, welcome. So what we're going to basically look at now is the local, segmental and central response to acupressure. Now the effect of acupressure on a local, segmental and central response is going to be very similar to acupuncture. Where it's going to differ is going to be on the local effect, purely because in certain needles, if you're doing a dry needling technique, is going to cause microtrauma to the area, where if you're applying pressure, that's going to cause more ischemic compression and bring more circulation to the area. So that's where it's going to be slightly different in its effect. But however, physiologically, as long as you're using classical acupuncture points, then the effect of that is going to be very, very similar. Uh, I'm not just purely talking about treatment on a pain basis. In this respect, I'm talking about the function, the physiological function of each of the points. So that's pretty much what we're utilizing the points for. That's what our focus is going to be. And so when I'm teaching you the utilization of key acupuncture points or acupoints, I'm not teaching you from a pain basis. I'm wanting you to purely look at it, particularly if you're treating musculoskeletal disorders. You need to understand pain is a symptom. If you target the pain, you're missing the big picture. What you should be targeting is if there's swelling, your primary objective is to get the swelling down as quickly as possible, because the swelling is going to compromise the healing process, and therefore use points that then initiates the process of healing. So that's how you basically want to start to understand that. And same again, if you're wanting a local response, the difference between a local response and a central response, you're going to find if you can initiate a central response, that response is going to be far greater in its effect and longer lasting in its effect than if you initiate a local or a segmental response. So again, it's a technique, and also understanding whether you want a sympathetic or a parasympathetic response. So these are what we're primarily going to take a look at now. So by the end of this session, you'll have an understanding of the central, segmental and local response to acupressure, and also how acupressure is going to affect the autonomic nervous system. So that's where we're going to look at more the sympathetic and the parasympathetic effect of acupuncture, and that's going to depend on the location in which you choose your point. So that's going to be quite important to understand. That is depending on where you actually choose a point. And if you say, for example, want to treat the knee, but you don't want to choose points in and around the knee, you can choose points in the low back. Segmentally, it's going to have a similar effect. That's mainly going to be on the pain basis. So as I was saying before, if we're looking at needling an area and putting a needle into the area, the local response to that, and that's just doing more a dry needling effect as opposed to choosing acupuncture points, the local response to that is going to initiate an inflammatory response. And the way in which it's going to initiate an inflammatory response is it's going to cause microtrauma, it's going to cause key cells to cause chemotactic reaction. And that's going to be things like your calcitonin gene reactive peptides. That's going to actually be in the area. You're going to get your substance P. That's going to be in the area, and they all cause vasodilation. If you cause ischemic compression in and around the area and then release that, that's going to cause pretty much the same thing. It's going to cause vasodilation and bring more blood to the area. That is going to also have an increase on the healing process. So each is going to have a similar effect. One is going to do it through microtrauma, the other is going to cause it from ischemic compression. So that's going to be the key difference from more your local response. However, you can choose points local to an area, which I'd say would be just as effective is choose acupoints local to the area. Say for example, you're choosing points in and around the ankle, as opposed to just pressing in around the ankle or needling in around the ankle. You'd be far better off locating points such as your kidney 3 or urinary bladder 60 or urinary bladder 62. Those points will have an anti-inflammatory effect, but it will also stimulate the healing process of the actual ankle and the ligaments in itself. It'll also have a direct, segmentally, it'll also have a direct effect on pain. So it's all how you actually go about locating your points. So if you're looking at segmentally, it's understanding the myotomes, the dermatomes, and the sclerotomes within that area. And they're all supplied by pretty much the same nerves. So by stimulating, regardless of how you stimulate it, whether you're going to apply pressure to it, whether you're going to needle it, whether you're going to apply laser to it, segmentally, it's going to have a similar effect if we're looking primarily at pain. So give you a quick example. If you look at points such as spleen 9 and also spleen 10, what you basically find is those points will cover all the nerve supplies to the knee. So just needling those 2 points segmentally on a pain basis, you will have an effect generally on pain to the knee. Alternatively, you could go up to L4 and in the lumbar spine and needle down along the lumbar spine and have the same effect segmentally. So you don't have to needle around the knee. You can do that along the lumbar spine segmentally. It will have the same effect on the pain because it's going to affect the nerve pathways that comes out from the actual spinal cord in itself. So it don't matter which way you actually go about that. What you're basically finding, again, if you've got somebody with an elbow problem, let's say the elbow's swollen, you don't want to treat in and around the elbow, you can go back to the vertebrae and needle along there. That will segmentally also have an effect on the actual elbow itself. So it's all how you actually go about it if you're mainly addressing pain in order to ease the pain so that the patient can do exercise and start to stimulate the response. One of the key things also, so as we're saying, is on a segmental basis, depending on where you actually needle, you're going to find centrally, you're going to find a strong response is going to be out in the extremities as opposed to needling up onto the torso. So that's going to be something that's going to bear in mind. So again, stimulation on the trunk elicits a segmental spinal response, but in most cases the segmental response is going to be a sympathetic one, where again is also you're going to get your segmental response if you needle it out into the periphery. Now, coming back to the central response, that's one of the key things that you want to aim for. The stronger the central response, the longer lasting the effect, and also the greater the effect. Now, let's say, for example, we're applying needling or more acupuncture, and you was wanting a strong central response for pain. The key thing is it's the length of time you leave those needles in for. So key thing is if you're wanting to have a strong response for pain, you can needle points such as large intestine 4 in the hand or liver 3. You needle that point, all 4 points. If you leave those needles in for 30 minutes or more, that starts to initiate more of a central response. However, if you're actually wanting to do it from pressure, acupressure, you would have to regularly be stimulating those points and get the patient to stimulate those points on a regular basis throughout the day. And that will help to release the endorphins into the system. So now you're going to have a central response, and therefore that effect is going to be more accumulative and longer lasting. And it will affect certain areas of the brain such as the hypothalamus, the periaqueduct grey, and also the descending pain pathway. So it will affect all the segmental, local and segmental effect, as opposed to just having a local or a segmental effect. So if you start to look at the effect on the autonomic nervous system, do bear in mind, particularly if you're going to be treating any kind of visceral disorders, you want to have an effect on the stomach, or you want to have an effect on the bowels, or you want to have an effect on the bladder, or even if you're doing women's health, you do need to think what points you're going to choose and where on the body you actually choose those points. For example, if I want to calm the heart and reduce my heart rate, then what I'm going to need to do is have a parasympathetic effect. So therefore, I would need to choose points in the periphery on the hand, pericardium 6, heart 7. That will have a parasympathetic effect on my heart, or the patient's heart if I'm treating a patient, and it'll bring my heart rate down. However, if I want to enhance my heart rate, prep me for activity, for sports or something like that, I'd probably use something like lung 1. Or I can use my heart point on my torso, which is going to be REM 14, or I can go to use in the region of urinary bladder 15. So they'll have a direct effect in around the heart and lungs and enhance that, but that's going to be more of a sympathetic response. So they're quite important. If you want to increase the motility of the stomach, so think about your fight or flight. If somebody's preparing for activity, it's a sympathetic response. And what that's going to basically do is to take blood away from the stomach and send it to the brain. So therefore, that's what's going to happen on a sympathetic basis. So that means that if I want to increase the blood circulation to the stomach, I'm going to utilize a point in the periphery, which will be a parasympathetic response, such as stomach 36. That's going to increase motility of the stomach, and it's also going to increase blood circulation to the stomach. However, if I want to reduce that and have a sympathetic response, I would choose points on the torso, and that would be something like urinary bladder 21. That will have a similar effect of reducing, because it's going to be sympathetic. So always remember that torso between a certain level is going to be sympathetic. Extremities is going to be parasympathetic response on your visceral organs. So that's something important to remember. Don't choose a point because it says it's going to have an effect on the stomach, or it's going to have an effect on the kidney, or it's going to have an effect on the bladder. You need to know whether it's going to be a sympathetic or a parasympathetic effect, depending on where that point's actually located. I'm hoping I've got that clear in everybody's mindset, because many people just look at the function of the point but not look at the location. Depending on the location is going to depend in as whether it's sympathetic or parasympathetic. So in other words, if you've got somebody who's incontinent, or if you've got somebody who's bladder problems or anything like that, it depends as to whether you're going to choose a point that's sympathetic toned or parasympathetic toned. Therefore, that's going to be where the difference is going to be. Okay, so once we start to understand that, again, depending on your stimulation. Now, a lot of people is under the impression that points needs to be stimulated strongly. It depends on what you're treating and what your treatment response you want. You need to think very, very carefully as to what type of treatment response you actually want. So let's say, for example, I'm wanting a strong reaction, I'm wanting an increase in activity, and I'm wanting more of a sympathetic response. Then what I'm going to basically do is choose points on the torso and stimulate it quite vigorously. If I'm wanting to calm, then I'll choose points in the periphery and give it more of a gentle stimulation. That's going to give it more of a parasympathetic. Strong stimulation into the muscle, whether you're needling or whether you're applying pressure and you're applying strong stimulation, that is going to give it more of a sympathetic tone. However, if you're going to do gentle, you want to calm something, then have a more gentler parasympathetic approach to it. So again, if you're needling, for example, then I'd say put the needle in, gentle stimulation, or leave it. Okay, that will give you a parasympathetic, more of a parasympathetic response. So if you're talking about an acute injury, that's the approach you want to take. If you're talking something chronic, then you can take more of a sympathetic approach. So always think about your sympathetic, parasympathetic location as to where you're going to actually put the needles. So that's quite important. Well, the other important thing to bear in mind is the location of the point. Now, with regards to location of the actual point in itself, you're going to find all your most effective points on the body is going to be from your hand downwards and then from your feet downwards, or you can take it from the elbow down and from the knee down. That's where you're going to find the most effective, but the majority of them are in the hands and face. So that's where they are, not necessarily on the torso, not necessarily on the arm. So if you look at this homunculus here, what we basically did, we went to the science centre up in Glasgow. I took my boys, and we was having a good look round, and I tend to discover this particular image. I used to use a different image, but what better image to use than what I've got now? And it's basically showing that a big face, big feet, big hands, but rest of the area of the body is relatively small compared to that. also, if you notice, you've got bigger ears as well. So they are showing you quite strong points, very strong effect. So once you start to look at things like Korean hand acupuncture or hand acupressure, even though we're not touched into reflexology isn't used that much in the healthcare profession, but I'm sure if we start to use it in the healthcare profession, a lot more research would go into that. And once that research did go in, and then you start to get more evidence based, I think reflexology would be another area of treatment that would start to expand and be used more in the health profession. It's just that hand acupuncture is something in Korea that's practiced quite a lot by healthcare practitioners. But however, auricular, again, that's one that's used quite a lot. A lot of research has gone into that. And then a lot of research is going into your scalp acupuncture as well. So again, they're demonstrating to be quite effective. So I in my opinion to that, I don't see any reason why reflexology should be any different than your hand and your auricular, where they're using, you know, smaller areas of the body to map out the rest of the body. But that's where you're going to find your most potent point. To give you a quick example, I know a lot of practitioners who do dry needling, for example. If they was to treat the back, they'd put all their needles into the back to treat that. Now, if you've got somebody with an acute back problem, that's the last place you want to be putting the needles. Your most effective point, whether it's acute, chronic back, your most effective point is in the hands and feet and face. And I've demonstrated that numerous times. Very few studies do I see where they're treating acute back pain and have used mainly points on the hands, face and feet. Most of the points are still in the back. So to me, that's a lack of understanding of the practitioners who's actually treating those particular areas. If you want a very quick, very effective result, that's where you want to actually be putting your points. Your back, the points that you put in the back is only there to support, or you might be utilizing that to try and relax off the muscles. But if you utilize points such as your yin tang, your do 26, those 2 points in itself will help to relax the patient, significantly relax the patient. Again, you've got your small intestine 3, which is located here on the hand. Now that point is very effective for acute and any muscular or spinal injuries, whether it's acute, chronic. So again, very effective point. So there are some very, very good points you can actually use, and there's several other points in the hand which you normally put in acute cases and get your patients to walk around and move around, and it loosens up the back. So these practices you can actually apply. So don't make the assumption that your most effective point is in the area in which you're actually going to be treating. Most of them is going to be distal in the extremities. So always try to think about that, is where the points are actually located. As I was saying, your most effective point is below the elbow, below the knee. And that's where you're going to get your strongest and your most effective treatment outcome. So before you actually start any treatment, one of the key things you need to ask yourself is, are you wanting a local effect, you wanting a segmental effect, or spinal, central, sympathetic outflow, parasympathetic outflow, or you actually want an immune response? And that's all going to determine as to where you're going to choose your points and how you're actually going to stimulate those particular points. So let's say, for example, you're wanting a peripheral or local effect, then you're basically going to just choose points in and around the area of the actual condition or the injury in itself. Okay, if you're not, then just choose points away from the actual area. If you're wanting a segmental, then what you're mainly doing is choosing points in the same myotome, dermatome or sclerotome. So it don't have to be directly in the area, it's got to be along the same myotome, dermatome, sclerotome, stimulate those points. If you're not wanting that, then you can stimulate out of those tissue areas that supplies, or the nerve supplies, to the actual structure in itself, whether it's the knee or whether it's the shoulder. You can choose points away. For example, if I'm treating the shoulder and I'm not wanting a segmental effect, I won't choose points in and around the shoulder. I'm not going to choose points further down my arm. I can choose something like gallbladder 34, which is in my leg, completely out of the same segment as my shoulder, and it'll have quite a significant effect on my shoulder. It will enhance circulation to the shoulder. Research has demonstrated that, and it's also demonstrated that gallbladder 34 will outperform points local to the shoulder. So again, it is important as to how you actually, utilize that point. Well, the key thing is, particularly in acute cases, you do not want to be needling in and around the area, especially if there's any swelling and inflammation, because the area is going to be quite sensitized. And the last thing you want to do is, if you needle or apply pressure in and around that area, what you're going to basically start to do now is to flare the area up. You're going to make it a lot more sensitized than what it actually is. You're going to cause more swelling, and that's not something you want. So therefore, that's going to cause more pain to the patient. So the best thing to do in that case is use points away from that area. That's going to reduce swelling. It's also going to reduce pain and the sensitization of that area, and that's where you're going to get the best effect. If you're wanting a central effect, again, choose your big points. Big points in the hand: large intestine 4, liver 3, stomach 36. That's going to give you more of a strong central effect. Spleen 6 is going to have a strong central effect as well. So choose your big potent points. That's where you're going to get the best effect. Stimulate them. The longer that point's stimulated, whether you're applying needling or pressure, the greater that effect's going to be. So thank you for listening in that case. I hope you've got as much information. I hope you understood what I was trying to pass over there. You can watch this presentation over and over again at your own leisure. If you've got any questions for me at all, you can get back to me at info@stevebaileyAcupuncture.com.